Welcome to the Pure Wellness Podcast, where we talk about what it takes to live a holistic lifestyle by making conscious, healthier choices. Our hope is that these discussions will inspire you to strengthen your daily practice to improve overall physical, mental, emotional, and social well-being. Pure Wellness Podcast provides information solely for educational purposes and is not intended to be a substitute for professional medical advice, diagnosis, or treatment. I'm your host, Johanna Altman, founder of One Body Medicine, avid health enthusiast, and mother of three. Join me and industry professionals as we explore human potential in the pursuit of pure wellness. Welcome to the Pure Wellness Podcast. Thank you guys for joining me for episode 1, where we'll be talking about mainstream medicine. Here to join me is Dr. Allen. He's actually our medical director for One Body Medicine, and I'm looking forward to speaking with him and asking him some very basic questions about mainstream medicine and what it is. So, Dr. Allen, if you wouldn't mind just introducing yourself and giving some background.
Sure. Thanks for having me on, Johanna.
Of course.
I'm Dr. Allen Cho. I am an emergency medicine specialist. I'm board certified in emergency medicine. I have my undergraduate degree in biomechanical engineering from Stanford University. And after that, I went to the University of Pennsylvania, where I got my MD. I was in full-time practice for about 5 years. And as I was seeing patients in the emergency department, I started to notice that a lot of them were not getting better. Even though I was performing acute care interventions, some of them were not managing their chronic disease and had no idea how to take care of themselves. And so I became increasingly dissatisfied with that line of practice. I left eventually to start a surgery center full-time with some pain management physician partners, where we did regenerative care and targeted interventions in order to treat specific conditions. But even that, I felt a little bit dissatisfied with, because at the end of the day, we were just giving the patients medications. In 2021, in the height of COVID, my wife actually was diagnosed with long COVID. And that was actually a devastating illness to us, not only because it changed the way that our family functioned and lived, but also because we had gone to so many different traditional doctors and nobody was able to do anything for us. At that point, I think I went off into the great unknown, where I looked into emerging therapies and alternative treatments and integrative healthcare. And through that, we were able to find different ways to support her condition until she was able to heal on her own. And I think since then, I've developed a real passion for taking care of patients who might be at the end of the road in terms of what they've tried for medical treatments, and also for patients who just want to make themselves well.
Yeah. So I think that speaks to a lot of people, especially during COVID, and a lot of information that was going around. Do we get vaccinated? Do we not? I know that's a more in-depth topic, but it was such a pleasure meeting you at the surgery center, because if you recall, I had that one patient who was told that she needed to have a surgery on her C5, C6, which is just the spinal part, the upper spinal part of her neck. And that was a last resort. She was afraid of that. And we met at your surgery center, where Dr. Kim did the stem cell injection in between her neck vertebrae. So I'm so grateful we were able to meet then, because now we're on our mission to help people get well.
And absolutely, we started One Body Medicine, and it's been a great journey since then. Yeah,
so far. I'm looking forward to helping more people. So in our discussion today, mainstream medicine, I wanted to discuss this because I feel, even for myself, not being in the medical field, those terms have been thrown around loosely. Mainstream medicine. What is that? What is mainstream medicine?
I would define mainstream medicine as just a blanket term for the type of care that you would expect to receive at the average doctor's office in this country. And largely that stems from the allopathic medical tradition, where you go to medical school and you learn how to treat various disease conditions with drugs. I do believe that mainstream medicine has many, many good things that come out of it. To start, there's strong focus on understanding pathophysiology and mechanisms of disease and finding evidence-based interventions on how to treat them.
Okay, so I'm just going to pause because that was a huge chunk of knowledge. So going back to the pathological pathways, could you go more in depth about that? Because I'm not too well versed in that.
Sure. So with mainstream medicine, the focus is on finding a specific diagnosable disease condition and a biological mechanism underlying that could be targeted with some kind of intervention. I think what that leads us to in this country is what I term sick care, where you go to a doctor and you have an identified condition, and we give you something to treat that condition, and that's pretty much the end of the therapy.
Is that the same as treating the symptom? So when you say treating the condition, would you say that's the same as treating the symptom? Because my understanding, what I've seen with friends and family, is oftentimes it seems like the symptom is being treated and not the underlying illness or disease. Is that the same?
That's right. I think that there is less of a root cause approach in traditional Western medicine, and less of a holistic element where you evaluate all the other factors that might go into the patient's wellness, including preventative care and overall well-being.
Okay, so that's what I'm aware of. So in terms of also, right, just your journey, my journey with family, I feel like growing up, everything that I've learned about my health or prevention, if you could call it that, was information that made me feel I was 100% reliant on my doctor. If I had a cough, if I had the flu, if I had a rash, or whatever the ailment or condition might have been, that the number one person I would go to would be my doctor. If my doctor said I needed this prescription, I was to take it. And I really wasn't in a position to question their recommendation, their treatment. And I think so many people have that feeling that maybe if they're having symptoms or they don't feel well, they kind of ignore their symptoms because they want validation or they want their doctor to tell them exactly what's going on with them. Do you feel that reliance on our doctors or the way that society has kind of made us feel that we're not sure about how we feel or our symptoms has made us less independent in seeking out these other holistic or integrative forms of therapy?
That's an interesting question that I want to unpack a little bit. I think part of it has to do with the fact that traditionally the medical system has been somewhat paternalistic, meaning they want to tell you what your diagnosis is and put a diagnosis code and then give you something for it. When in reality nowadays, most doctors don't spend enough time with their patients to really understand what could be affecting them and what could be causing the symptoms. A lot of that has to do with our underlying healthcare system and how it's structured, because in order for insurance to pay for something, there has to be a diagnosis code, there has to be a treatment plan. And because doctors have to follow insurance guidelines, they may not have enough time based on reimbursement and other issues to spend a full 30 minutes or an hour with talking to a patient about what's really bothering them. They're packed into 15-minute appointments. They find something wrong, they put it down, and they give them something to try.
Yeah, that's sad. Isn't that sad? I mean, a story I have is I just remember my dad, who's no longer here, coming back from the pharmacy and having 10 or 12 bottles of medicine, each seeming to have more side effects than the other. So I think that I've personally seen that with my family. And having said that, how do you feel? Do you feel that integrative, regenerative medicine is kind of making its way to where the masses are now shifting? People are now becoming their own health advocate because maybe they're tired of mainstream medicine. How do you feel that our field, One Body Medicine, and wellness clinics such as ours are changing the way people look at wellness?
The term wellness is key to understanding this, because I think if I could unwind everything and go back in time, all of these patients would be taking care of their health and they wouldn't get to the point where they need to be on 10 medications in the first place. Now, you do see those patients where they're taking 10 medications and they have no idea what they're taking. And those interventions really should have started much earlier on, which is what I think you're touching on, is individual health literacy. Having a good knowledge on how to stay well, how to prevent these disease states, and what you can do. In cases where you have serious disease, I definitely think that you should follow the advice of your doctor, take the medicines and do the treatments. But a lot of that could be prevented if you start early and you really take care of yourself.
Yeah, that makes sense. So I guess that prompts another question in my mind, which is, if we were not fortunate enough, for example, to have more preventative intervention, and we now find ourselves in a position where we have a handful of prescription medications, is there a way, do you believe there's a way to slowly get better, depending on the condition, where we're not reliant on maybe 4, 5, or 6, or all of these medicines? Is there a way to still utilize integrative medicine to get better if we did not take advantage of this preventative care that you're talking about?
I think in order to build a foundation of health, you have to work on the foundational elements of health. Those would be having an adequate diet that's full of nutrition, getting adequate sleep and optimizing that, and implementing a movement routine where you're conditioning your body to not be injured and to be building muscle and strengthening your bones. We can go into each of those in more detail in perhaps a later podcast.
Yeah, I agree. So I don't really have any more questions. I feel I have a pretty good idea of mainstream medicine, the differences. And I just want to thank you so much for being on this podcast. And hopefully we'll see you soon. I know you're going to be a recurring guest, so I'm looking forward to all those other podcasts.
Great. Thank you for having me on.
Of course. This podcast is sponsored and brought to you by One Body Medicine. You can learn more by visiting onebodymedicine.com. That's the number 1, bodymedicine.com. You can also follow the show on social media under the handle Pure Wellness Pod. Thank you for listening, and we'll see you next time.